Is your headache harmless or a warning sign of something more serious? It's Dr. Brown, and here are 3 types of headaches you should never ignore. Number 1, the thunderclap headache. Often described by patients as the worst headache of their entire life. It's a sudden headache and it peaks with intensity within seconds to minutes. This headache often signals bleeding in the brain or ruptured cerebral aneurysm. Any sudden severe headache should be evaluated by a medical professional immediately. Number 2, any headache that is associated with neurological symptoms. So if your headache is associated with symptoms like weakness in any of the limbs, difficulty speaking, that is slurred speech or inability to find your words, visual changes including vision loss, and or confusion or being delirious. This can signal an acute stroke or a neurological condition. Don't ignore a headache like this. Number 3, a headache with a fever or neck stiffness. If your headache is associated with fever, neck stiffness, or confusion, this can be a sign of an acute infection known as meningitis, infection or inflammation of the lining of the brain. An infection like this can be fatal, so it's very important that you don't ignore your symptoms. As a doctor in primary care, most headaches that I see are migraines. Sometimes they're associated with a sinusitis or inflammation of the sinuses or a tension headache. However, I've seen patients where their headache meant something much worse, so don't ignore the red flag symptoms. Save this video if you want to remember the warning signs.